Hope you're all well. I am coming on today because I have had a few inquiries about Kegel or Kegel exercises. So I figured I'd just jump on today and talk about this topic a little bit more in detail. So yeah, we'll talk about Kegels, what they are, how to do them, and who should be doing these exercises. So first of all, what are Kegel exercises or Kegel exercises? So these exercises are exercises that target the activation of the pelvic floor muscles. And they were initially sort of taught by a doctor. I believe it was in the 1940s. His name was Dr. Arnold Kegel, and he felt that it was important to be able to train and activate pelvic floor muscles, especially in the postpartum or postnatal population. So hence the term Kegels, named after the doctor that discovered this specific type of exercise. And so what is a Kegel exercise? So if we look at the muscles of the pelvic floor again, okay, so these muscles go from the front to the back, and they also go from side to side. Okay, now unlike some of the other muscles in our body, for instance, let's talk about our bicep muscles. Okay, our bicep muscle actually just moves in one direction. It can contract, it can relax, and it's usually in one linear range of motion. Because our pelvic floor muscles are in sort of different directions, the muscles are in different directions, it's really important to be able to understand how to do these exercises appropriately. Some individuals will just try to tighten and squeeze the muscle, but in actual fact, when you're doing an appropriate Kegel exercise or an appropriate activation of your pelvic floor muscles, the movement is more of a closing and a lifting. Okay, so if we have a look again, we are looking to create a close and then a lifting into the body. So it's almost like a closing with a pulling in to the upper part of your torso. So how do you do this? It can be quite confusing. It can be hard to connect to these muscles for some individuals. And the big reason is because we can't see these muscles, right? So if we can see our bicep muscles, it's really easy to see that you're actually contracting the muscle. But with pelvic floor muscles, that's not the case. So sometimes it can be really helpful to use imagery or visual cues to be able to turn these muscles on properly. So one of my favorite cues to use is to think of a marble. And I want you to imagine a marble at the entry of the vagina. And what you want to do is try to think about closing over the marble and then drawing it up into your vagina. So again, it's a close and a lift. And when you're thinking about different visual cues that can help facilitate this movement of a close and lift, sometimes individuals can start to connect to that muscle better. And other people like to use different visuals. So some people will think of like a little bean at the entry of the vagina, or think of like a ping pong ball that they're trying to pull into their body. Another visual that can help with some individuals is thinking of a jellyfish. And when you see a jellyfish, and you can probably Google a video of a jellyfish moves sort of in this direction. So thinking of the contraction as this part of the movement when a jellyfish is swimming around in the water. Okay, so we've covered what Kegels are, how to do them. So who should be doing these exercises? Because it is a myth that every single person should be doing them, and I think it's usually the first recommendation that's given to a lot of individuals from health practitioners, but it may not always be appropriate for people to be doing these exercises. So you really do want to be careful and be mindful as to how you're feeling if you decide to try Kegel exercises. And the population that I think really needs to be quite mindful and really sort of tune in to how they're feeling when they're doing these exercises are those that struggle with pelvic pain or sexual pain, okay? And this is because in a lot of pelvic pain conditions and concerns, some of these muscles may be excessively working, they may be overly tight. So if you think about your shoulders, okay, if you've been sitting at a computer all day and you have your shoulders up to your ears like this without even knowing it because you're so focused into what you're doing, you can see how the top of my shoulders, these muscles are already so tight. And if I try to activate them more, I'm really not going to have much success in getting more function and activation through those muscles. So it's the same for the pelvic floor. So if somebody's in pain, if these muscles are already too tight and you're trying to do a Kegel exercise to contract and activate these muscles more, it can actually create more issues, more problems, perhaps more pain, and more of those adverse symptoms that we don't want to feel in the pelvic area. Okay, so that's my one big tip when it comes to these exercises. It's not for everybody, so please just be mindful about that.